Hello, everybody. Thank you for coming today. This is the Ekam Global Webinar on November 1st. Wherever you are in Europe, Canada, all over the world, thank you for coming here. We have a number of speakers today that will speak on different topics, and we will also be endorsing the Ekam organization. So we have with us today Dr. Sai Lakshmi, the founder of Ekam, and we would like to have her talk for a second, but after this, this is the welcome address. 1 second.
YouTube link is not working.
It seems that the YouTube live link is not working, but give me 1 second. Dr. Neelama?
Yes.
I've stopped the request access control, so give me 1 second now. Hold on. So it seems that the YouTube. Hello to all of our viewers all around the world. My name is Samir Panopoulos, and I will be the host of your webinar today. This is the Ekam Global Webinar in association with the Lead India organization. We have with us today Dr. Hari Panopoulos, the chairman of the Lead India organization. And in this webinar, we will have presentations from different chapters from Canada, the UK, and the United States. As well as we're also going to present the impacts that we have made in India. We will have a number of speakers, such as our chief guest, Mr. John Reddick. Our youth representative, Anya Ahuja, will also be speaking today. She is the youth ambassador for the Ekam organization and also hosts her own radio show on the Radio Caravan channel in Dallas, Texas. I would like to thank our founder, Dr. Sai Lakshmi, for making the whole webinar happen. She's a key aspect of Ekam's actions and our deepest gratitude towards you. I would like to start by acknowledging the COVID-19 cases. As of today, there are millions of cases in the world. This virus has not just stopped one activity, but the entire world's economy, healthcare, recreation, and regular life has come to an abrupt stop. We are slowly progressing as we have learned to move on in the midst of this pandemic, but that is not easy for everyone. With the political and economical landscape ever changing, there are additional challenges for those in poverty. Businesses are closing down, leaving millions unemployed. Hospital beds are filling up to the brim, leaving people with pre-existing conditions not being able to be cared for. This is especially prevalent in the lower class, and Ekam is dedicated to improving healthcare for women and children. And at the stage we are at right now, we have to capitalize on it. So I would now like to ask the MCs to take away with the show.
Thank you, Samir. So before we move on, I'd like to highlight our host, Samir Epanopoulos. And Samir Epanopoulos is a 10th grader from Bakersfield, California. He's the founder of the website successview.org, which focuses on inspiring the youth to be successful by learning the meaning and path to success from successful individuals through interviews. He's also part of many clubs and activities in school, taking the first place in Lincoln Douglas debate in his county tournament, as well as being a finalist in his regional speech tournament. He is the youth ambassador for the Ekam Foundation and has started his chapter in Bakersfield. Samir loves sports and has a passion for them. In the future, he hopes to graduate from Duke University in North Carolina and become an entrepreneur, investment banker, or stockbroker in the near future.
Thank you so much. Now we will introduce Dr. Sai Lakshmi. Dr. Sai Lakshmi went to St. Francis College for only 2 years before gaining entry to Gandhi Medical College. She was there for 5 years and she left qualified as both a physician and a surgeon. On the 20th of January 2001, an earthquake hit Gujarat, killing 20,000, injuring many more, and making 400,000 homeless. She stepped forward to volunteer, and then, despite it clashing with her exams, 7 years later, she volunteered again when the Bihar flood made millions homeless, when a river changed the course of flooded many inhabited areas. She has been working as a junior consultant when she had tried to work out how to support the 60 orphanages she had teamed up, each one with a colleague pediatrician. Her colleagues were keen to help, but in times, the system was not really working. The establishment of the Ekam Foundation in 2009 was her attempt to refocus on the problem of supply and care. She was awarded one of the first 8 Nati Shakti Awards for her leadership and achievement in 2015. Your award was made on International Women's Day from then Indian President Pranab Mukherjee. Now let's welcome Dr. Sai to deliver her address.
Thank you, Samir, and thank you all. And it's a great occasion for Ekam. A dream come true, I would say. And Samir, being a young kid, it's amazing with your efforts. It's happening. So Ekam's journey. This is the 11th year, and started with a vision to work for the health and well-being of children, extended on to working towards the well-being of mothers and communities, has been wonderful. And it reiterated one thing that for any pure intention, nature responds with lots of love and abundance. And this is what I am actually seeing now. Started with a single individual, and now there is the global platforms which got set up thanks to Nilima, who set up Ekam USA, and it's like really growing big. And the UK teams, Ajay, Preetham, Rajni, and Vaikund, who started, and Ramak from Canada. It's amazing. In 10 years, it grew up beautifully. Samir, you could just start the presentation so that. So over a period of 10 years, realized that initially it started off as a charity mode in 2009, admitting the children as and when the children need help, starting with the private hospitals and then extended it into the government hospitals, and then realized that just working for the children and newborns, it would not bring down the neonatal mortality rate, and realized that we need to work for mothers as well. And then while working with the mothers, we realized that we need to work with the communities as such, and health as defined by WHO as physical, mental, emotional, psychological, and spiritual well-being is necessary rather than physical health, which doesn't actually bring in the well-being aspect. So that's how Ekam very strongly believes in bringing in the gross happiness of an individual, family, and community, which would ultimately result in bringing in the well-being of children, mothers, and thereby bring down the neonatal infant and maternal mortality rates. So that's how we ended up started working with the gross national happiness as one of the indicators. And if you see, United Nations very strongly propagates gross happiness, and the four pillars being sustainable development, cultural values, natural environment, and good governance. Next slide, please. So good governance plays a very important role in the journey of Ekam. We too realize that until and unless the governance is there, we cannot achieve what we want to achieve in bringing down the mortality rates. Samir, next slide, please. So as a part of the Sustainable Development Goals, the UN says good health and well-being. Next slide, please. So the well-being as measured globally is being measured as Happy Planet Index. So the Happy Planet Index, Samir, next slide, has four components in it. The four elements, again, next slide, Samir. So if you see the four components, well-being plays a very important role, life expectancy, inequality of outcomes, which is again brings in the governance aspect, and ecological footprint, where the environment plays a very important role. So it is HPI is well-being into life expectancy, into inequality of outcomes by the ecological footprint. And if you see, India is actually ranks 50th in position, and so we really need to are working all our indicators towards the Happy Planet Index, and we are calling it as Sustainable Wellbeing Initiative, which is in a big way funded by Ekam USA. Samir, next slide. So the Happy Planet Index, if you see, the countries which are actually materialistically rich are not ranking first, but the countries like Bhutan, which have these indicators, are actually standing ahead in the well-being. And we have taken the SDG indicators as the primary importance. And if you see the global maternal mortality rate, the target is to reach 70 per thousand live births, and the preventable deaths of newborns and children. So we are aiming to achieve this in different states in India. And so to start with, we have started in Tamil Nadu. Yeah, Samir, next slide, please. So the SWBI model has all the components which has the SDG goals, and the process and with which we have come across is to build a Ekam soul force, which has all the 5 pillars where we call as the knowledge aspect. Then there is a resource mobilization, incentivization and sustainability aspect, and there is a good governance, as well as there is a good administration which takes care of it. And so if all with these 5 pillars, we are aiming at building an Ekam soul force, which in turn builds an interbeing soul force, which is without Ekam. That is one of the core value of Ekam, which is the self-obsolescence, where we talk about build, own, operate, and transfer model. That is actually empowering a system rather than actually creating a dependency. So if you see, we start with an Ekam soul force, and the Ekam soul force in turn builds this interbeing soul force at district, block, and panchayat village level to make the mother, youth, and individual as a change maker. Until and unless the mother becomes the change maker and governs herself, or an individual govern themselves, it cannot become sustainable. So that's the goal of Ekam, to shift from Ekam soul force to an interbeing soul force. And next slide, please. So as you see, this is aimed to bring in CCPP committees, which is like community, civil society organizations, public and private sector, all play a very important role in taking the ownership. And once this is achieved by transferring Ekam soul force to an interbeing soul force, it gets handed over to the government, and the government operates themselves. So that's how it becomes a sustainable model. At the end of it, we do not want to depend continuously on donors, but it should become a sustainable model. So we have the vision and 4 core values, 5 pillars and 4 principles. Samir, can you go on to the next slide? Yeah, so the 5 pillars, as we have seen, building this interbeing soul force, which is without Ekam, by actually integrating it into the government system so that it becomes sustainable. So we have these other 4 pillars who actually support to make it happen. And the 4 values, you see, self-obsolescence is something where without Ekam, we need to come to a boot model that is build, own, operate, and transfer. And the 4 principles is bringing in the confluence, that is building the community, civil society, organizations who are proactive. They sort of actually form these committees at various levels, and they sort of actually converge with the committees which are existing with the government system, and which ultimately builds the interbeing soul force, and they take up the collective responsibility, and for which there is a sustained motivation which is needed, and we are working on it by bringing in intrinsic motivation process and integrating it with an incentivization process. So this is the complete model of Ekam to achieve the well-being of children, mothers, and community, and make it a sustainable model. So this is the vision, and this is now started in partnership with UNICEF, and multiple organizations have joined hands now, and we are going to show it in Tamil Nadu as a model, which would become a replicable model across other states. And so this has been an exciting learning, and it all got evolved by beautiful learning process which happened. And there's an amazing hands joined across, and you see that there's a global partners joining hands, and Ekam USA is playing a very big role in making us realize our vision currently, and I'm really excited sharing the model and vision, and thank you so much. Thank you.
Thank you so much, Dr. Sai. You are the Ekam Foundation. We truly are thankful that you've been doing so much with the volunteering, and it's really just revolutionary the work you put in, and we are all inspired by you. And thank you so much for agreeing to speak with us today. So, Dr. Lima, could you please share the presentation one more time?
The Ekam USA presentation?
No, could you please share the global webinar presentation?
Yes, I'm sharing my screen.
In that time, MCs, could you please introduce Dr. Neelima?
Yeah. So, Dr. Neelima Reddy is a gastroenterologist in Baton Rouge, Louisiana. She received her medical degree from Gandhi Medical College in India and has been in practice more than 10 years. She graduated in internal medicine and gastroenterology from the University of Alabama in Birmingham. She's a fellow of the American College of Gastroenterology. Dr. Reddy currently serves on the Colorectal Multidisciplinary Care Team, or the MDC, at Mary Bird Perkins Our Lady of the Lake Cancer Center. She's involved with the organization of the Get Your Rear in the Gear Colon Cancer Awareness 5K in Baton Rouge. She has been the director of the Ekam USA chapter since 2016 and it is a huge part of the Ekam Foundation team. Now let us welcome Dr. Neelima Reddy to deliver her keynote.
Thank you for that introduction. I'm so glad all of you have joined this presentation that we are doing for Ekam, none of which could have been possible without all of your support, the volunteers and the donors, everyone that has been involved with Ekam right from the beginning, thanks to Dr. Sai Lakshmi and her connections. So I would like to take to the Ekam USA presentation. And you know, I'm a doctor when you see some glitches happening probably with the Ekam USA presentation. Here you go. So we started in 2016 to support the work that's being done by Ekam Foundation in India. The three of our board members, of course, myself and Aruna Vatsavai from Baton Rouge, who is our finance director, and Shilpa Pupala is our PR and media director. And Dr. Shilpa is in California and has been actively involved with this, with the taking over and running of the Ekam from day to day. So of course, Ekam USA was started so that our mission statement being no child should be refused healthcare because of financial constraints, and no parent or doctor should ever feel that they cannot give the necessary treatment because there is money is not available. As Dr. Sai says, she did not become a pediatrician to be able to save children if they have money and not save them if they don't have money. That is obviously not what we went to school for, to train to save lives, and that's how Ekam came into existence. So we started in 2016 and we have grown exponentially since then, with right now 20 active chapters across USA, more than 350 Ekam youth ambassadors who are the core of Ekam. And each chapter in USA has adopted a district in Tamil Nadu to understand the working of Ekam firsthand. This shows the spread of all the Ekam USA chapters in different cities that have been started by volunteers and generous people that want to do more work and are being coordinated by the local chapter coordinators who take so much effort and time in taking care of these activities. And this shows each chapter in USA and the district that it has adopted in India and the chapter coordinators. And we'll see some of these activities that have been done. We primarily focus on volunteering and service activities to be done locally. And our goal is to keep the youth ambassadors engaged, and as well as the fundraising activities, which are for the core of Ekam's work that is being done in India. And we'll see some of these impactful projects which were done locally, globally, and of course now with COVID, virtually. So now I give it to Anya, who is in charge of our Global Youth Ambassador Program. And she has done a lot to serve this, to spread the message of Ekam across the world.
Thank you, Dr. Neela. Namaste and howdy everyone from Dallas, Texas. Good morning or good evening based on where you joined us today. This is RJ Anya Huja. As Dr. Neela and Samir said, I am a 13-year-old radio jockey, blogger, and writer. I do a weekly show called The Youth Spotlight with Anya in a Dallas-based radio station called Radio Caravan every Monday from 4 to 5 p.m. All the details of that can be found on my Instagram page at RJ Anya Huja. First, I want to start off by saying that I couldn't be more honored to be invited to speak on the first ever Ekam Global webinar, and I'm also extremely honored to be a part of the Ekam Foundation. I've had the pleasure of meeting Dr. Sai and Dr. Nilma in person, and their selflessness, compassion, and just good intent for the Ekam Foundation is truly inspiring to, I think, everybody, and it was inspiring to me from day one. I've used the resource that I have through my radio show to spread the word about Ekam. I've helped initiate to take different Ekam youth ambassadors from different regions on air with me to throw light on what they're doing and interview them. And that's spreading awareness of this foundation through radio. And of course, this needed some legwork of getting the approvals and a lot of coordinations. And I also have a podcast for our radio show. And since I have that sort of experience, the idea to have a podcast for the Ekam Foundation, Dr. Neelam Reddy and Dr. Sai both approved it. And now we have a podcast dedicated to Ekam. We already have 5 episodes out. It's free and an easy search. Just search Ekam Foundation on Spotify, iTunes, and Spreaker. And we're announcing it here for the first time, so I'm super, super. And it also got added to several other podcast platforms that we've submitted for approvals. Those are Podcaster and Podcast Addict. With a simple search of Ekam Foundation, y'all can listen to all of our uploaded episodes. Our latest podcast episode is with the EYAs from the University of Texas at Dallas, or UTD, and y'all should check it out to meet the executive team of the Ekam UTD chapter, led by Reshma, Ananya, Charu, Christy, Devi, and Anjali. They were amazing girls to interview, and they're doing a lot of good work for the Ekam Foundation in that university. And I wanted to give a special shout out to Reshma for coordinating this event, this podcast, and Dr. Shilpa from California for all the guidance and making all of these episodes possible. Some other upcoming things that we're working on are that Amazon has recently launched a podcast platform called Amazon Music Podcast, and we're trying to get the Ekam podcast there as well. There are several other podcast platforms such as iHeartRadio, JioSaavn, and Deezer that we're working on to get our podcast hosted there. And we submitted the request and sent all that is needed. All we're doing is waiting on approval. Here, basically, our goal for the podcast is that whatever source you listen to when it comes to podcasts, Ekam should definitely have a presence there. Our next podcast episode will be on PPE production and distribution work by the Boston Ekam Youth Ambassadors, or EYAs. Also, YouTube is another option that we could do if we ever wanted Ekam episodes to be in a video form. I've really never done anything in terms of YouTube as showing my face on the internet was something that we wanted to avoid as I was younger. But now during quarantine, since I've had a lot of time on my hands, I've tried doing a few YouTube videos to reach out to other kids in that platform because a lot of kids use it. I want to make sure they stay active and stay curious and stay connected through my show. And I am doing a YouTube video with an Indian singer for my radio show. And so we could just test out my YouTube presence from there. And then I'll start a YouTube for Ekam as well. So please let me know if you have any questions, or feel free to reach out to me at any time through Instagram at RJ Anya Ahuja. I want once again to thank all of you guys for the opportunity for letting me speak. And thank you so much. Back to you, Dr. Nima.
Thank you, Anya, and you can check it out, of course, on her podcast. But now we will move on to the main Ekam USA presentation, which is really want to make you aware of all the activities that have been done by our Ekam Youth
Over the
Ambassadors.
past year, the Indianapolis chapter has done various volunteer projects, such as combating hunger relief.
We also raised $2,500 via Caring Card Project. This helped support a school in Madurai, India. With this money, the school got some basic needs such as a TV, a copier, a printer, and a reverse osmosis water system. During our trip to India 2019 December, we visited the school. We were very eager and excited to visit the school, and the principal, teachers, and students were equally as excited. The principal proudly showed us the infrastructure we helped them acquire. He also emphasized how this has helped improve the quality of education and the clean water for the students. We were very happy to see the impact Ekam has on this school.
We are proud to be Ekam Youth Ambassadors.
These are some other activities that were done by Indianapolis locally to serve their community, and by Charlotte, including some of these.
I'm Saket Agava from the South Jersey Ekam chapter. Our chapter helped the Kanchipuram district in Tamil Nadu. We did a shoe drive, and many people donated shoes that were not used in their household, and it is very helpful for people to have shoes. It protects the feet and is pretty much a necessity, and many people in India don't have it. And along with that, we donated needed supplies for school, such as notebooks, and that was all donated to the Kanchipuram district, and it was all used and gratefully appreciated.
These cards were made for the disabled adults.
The COVID-19 pandemic especially impacted schools. Our team created a campaign to donate money to the Charlotte-Mecklenburg school system so that it could provide hotspots and Chromebooks for its students to continue learning virtually next school year. The money collected from our art and writing contest participants was matched by Johnson & Johnson to help us reach our goal of $800.
So these are but some of the efforts that were done, especially during COVID relief. We did even more activities to help the local communities.
Donated 6 large trays of freshly prepared food to be packaged as meals and distributed. The meals were meant to serve 70 members of the local homeless population. In total, 15 families donated 24 trays of food over a period of 4 weeks.
So these are the different chapters, Boston, South Jersey, that did support their local food banks. All of our chapters did similar activities.
We just want to thank you so much for all you've done for the New Orleans mission. We could not do it without you. So from the bottom of our hearts, thank you.
Thank you.
Hi. Thank you.
Hey, thank you.
I just want to thank you from me, myself, and all the ladies here at Room Haven. We love you and we appreciate you for donating. I want to say thank you. Thank you for donating.
Hey everyone, I want to tell you about a fun project we did in Ekam, Arkansas. We made corona prevention kits to raise awareness for pandemic control. Each kit consisted of the following items: 3 ounces of hand sanitizer, homemade masks, an information card about hand washing, social distancing, and wearing a
My name is Koshi and I'm a 9th grader. My brother and I helped make COVID prevention kits, which included hand sanitizers, hand washing information, and some homemade masks.
Our Atlantic City mission was in need of personal hygiene supplies. We spread the word in our community about this urgent need, and we were able to collect a lot of supplies. There was an overwhelming response from the community, and I thank everyone for the support.
As you can see, there were a variety of activities done both for food donation as well as community support in terms of PPE. Ekam Boston overdid themselves by donating tons of PPE that they made themselves. And we have a special project for the community hospital in New Jersey where Harris Sharif has raised $10,000 along with his family and donated to the local hospital, along with support from the Caring Crowd employees supporting this project as well.
Hello. My family and I have decided to create a GoFundMe to help Overlook Hospital in Summit, New Jersey. All funds were donated to the hospital and were used to procure PPE, which is personal protective equipment like gloves, masks, scrubs, etc.
And a special project was done by Ekam along with Charlotte. This is Charlotte.
PPE, which is
Charlotte Amel is a Johnson & Johnson employee who took it upon himself to connect and provide the necessary support to 2 hospitals in Connecticut. And we were able to do a fundraising partnership with Ekam and provide much needed support during COVID for this 2 hospitals in Bridgeport. Sorry for the glitch. I'm trying to get you Charlotte's information. So that's why I say you can't have all doctors in the community for Ekam. You know, we need some IT support. So we definitely could use some volunteers to help us with this for the now and for future as well. So that is a nice shout out for all of you to come help us.
Staff at Bridgeport Hospital and St. Vincent's Medical Center were able to receive some support that they would have never received without the Ekam partnership. So I thank you very, very much.
So we thank Caring Crowd and Johnson & Johnson because we were able to do a project to fundraise for Perry Place in Dallas, which provides healthcare for children without insurance, as we want to provide the same cause of Ekam that we do in India, also to be done for local communities in USA. And this was almost completely funded by the Caring Crowd and Johnson & Johnson employees that contributed to this project. So we are thankful to them. And now you can see the variety of talent that our youth ambassadors have put into fundraising for these Ekam activities.
would lead to such a meaningful impact and experience.
Our first fundraiser was the Durga Puja, which was led by Swaha and Radhika. We loved interacting with and educating our local community on Ekam. Our second fundraiser was at the Texas Indo-Physician Society, which was led by Ashwin, where we were given stage time to communicate with physicians about our volunteer efforts.
Our third fundraiser was with Kendra Scott, a well-known jewelry store in Austin, Texas. We served samosas and chais to customers and invited our friends to shop, and a percentage of the proceeds were donated to Ekam.
Through the pandemic, we've been focusing on innovative ways that we can make an impact in our community, starting a letter drive for a nearby nursing home to help seniors stay connected, and creating COVID care packages with masks, hand sanitizer, food, and water, and distributed it to homeless shelters in Austin. We want to thank Johnson & Johnson for matching our relief fund through Caring Crowd.
So these are all the different activities done by them, and Ekam Bay Area was also very unique.
Hello everybody, my name is Amrita Guha and I will be your English instructor for Ekam's 4-week tutoring course.
Yay! Also, I have another flower. This one's really pretty.
Oh yeah, it looks pretty.
Yeah. So we're gonna do a bunch of stuff.
They've tutored kids all through summer, put in countless hours to do different topics and help the children during the COVID pandemic.
Make a variable. 25 yet. So first is 15. Yes. Oh yeah, 15. Then it wouldn't be 20 because 20 is an even number. So let's skip that.
Okay.
Okay, I'm just gonna go back a little bit just to set
So
where
they
we
had
are
different
in
topics,
terms of
including
the
MIT
game.
app
So
development, Math Olympiad, art contest, science, Spanish, all kinds of things for all different grades of children, all while fundraising for their Ekam activities.
Covering what a star's lifespan is. Okay, so a star is actually born in a nebula. In the nebula, the gases actually shift, causing the gas to collapse within itself.
Okay, so today we're going to learn about multiplying fractions. And multiplying fractions is actually way easier than adding or subtracting fractions.
And as you can probably see, I have a bunch of introduction with all of these components in there, and these are actually really cool things.
Hola, me llamo Anika. I attended Charlie's Spanish classes this summer and I really liked them.
So this is how they supported their local communities and also used the funds to support the Bay Area food banks, in addition to sending funds to their district, Tanjore in India, and providing PPE as well as grocery donation in their adopted district in Tanjore. And we have some unique projects that the youth ambassadors have come up with.
Here in Arkansas, our project, Senior Suites, served to help nursing home residents by providing homemade snacks and treats, high in protein, nutrients, and calories.
We were able to coordinate between 20 home bakers to create a baking schedule, with each baker baking over 40 individual servings each day of their treat of choice.
From Nutella cookies to homemade donuts to avocado fudge brownies, our home bakers were incredibly creative in coming up with dessert ideas that both fit our nutritional standards and were extremely tasty.
Many nursing home residents were excited each day for what treats were going to be given, and most were even able to finish their serving. Thank all of our home bakers and volunteers for making this project a huge success, and especially Ekam USA for giving us this amazing opportunity to help out our local community.
Hi, my name is Anya Rao and I'm 13 years old. I've been a member of Ekam, Arkansas since May 2020. On July 1st, I started a baking project to help raise funds for Ekam, Arkansas. I baked a variety of goods including truffles, cakes, and macarons. Through this project, I have accumulated over 100 volunteer hours and raised over $500. Thank you to Ekam, Arkansas for giving me this opportunity.
Here in Arkansas.
So look out for this holiday music video coming from Ekam, Arkansas, from Ekam Bay Area with a talented musical EYA. We've done several workshops for the kids to help them in their careers. And we are doing a MediClown program and breast cancer ambassador program. This is to help kids be trained as a medical clown and be able to provide an environment of happiness to patients and kids. And this has already been implemented in India, and we're working on a project to train our youth ambassadors in USA to do this as well. And we are thankful to our college clubs, which is Ekam UT Dallas, Ekam LSU, and Ekam University of Washington. And these guys have been doing well. Now, all of these efforts, what have they done with these youth ambassadors is they have raised more than $52,000 for COVID relief efforts for food banks and homeless shelters and providing PPE in the USA. When COVID started, we were concerned if people would donate, but people have come out generously with warm hearts and have given more than usual, and have given about $72,000 that we were able to send for the COVID relief projects in India. At least $44,000 were also given for mother and child health in India, which is the core work of Ekam. We've tried to target the elderly, homeless, all the needy populations, and Ekam Foundation itself has given $1.2 million worth of PPE and medical equipment to 6 states in India. Now you want to see why you want to become a Ekam Youth Ambassador.
The Ekam Foundation is an organization that works towards providing quality healthcare to needy children and mothers in India, and thereby contribute to a reduction in infant, childhood, adolescent, and maternal mortality rates. The Ekam Foundation, its vision, and each of its activities and programs can be described using just 4 words: oneness, truth, compassion, and self-obsolescence.
Ekam is an organization that is driven to help women and children's health in India. The reason I want to be involved with Ekam is because I can explore better volunteering opportunities and it'll be better for our society.
And its purpose, which is to help children and mothers in need of health care. The fact that there were less privileged people than me motivated me to become a youth volunteer, join Ekam to help people in need.
I'm Shruti Ramanini, an Ekam Youth Ambassador from Pittsburgh. We use a site called Caring Crowd, which is an online crowdfunding platform. It helps turn caring into action. This site, made by company Johnson & Johnson, has the tools and resources to attract new donors. We have utilized this platform to create various projects.
Along with the satisfaction of helping many others, Ekam can also give many volunteer hours. These volunteer hours can contribute to earning many things such as the Presidential Award. Hours in Journeys is very helpful for many Ekam projects.
I love being an Ekam Youth Ambassador. Are you interested in becoming an Ekam Youth Ambassador? On the website. After you register to become an Ekam Youth Ambassador, you and your parents will get all the information you need.
Hi, I'm Divya Tirumala from Pittsburgh. To get more information about Ekam, go to ekamusa.org.
So now you'll see all the projects that the funds the kids have raised, how they've been used, and to each of their adopted districts. This is an example of a summary of the activities that were done in India by these funds raised by the kids.
Ekam Pittsburgh has adopted Villapuram district in Tamil Nadu. So far, our team has raised $4,000 and helped to build 2 bathrooms in Salukai High School to improve sanitation. We have also raised funds to educate young girls on menstrual health and also supported health screening in our adopted district.
During the course of this year, we have collected funds from activities coordinated by Chinmaya Mission Pittsburgh for the purchase of a ventilator in Villapuram Government Hospital in Tamil Nadu. This was timely during this COVID-19 pandemic.
I'm passionate about women's basic needs, so I recently created a caring crowd to supply women menstrual hygiene products in India. And I also, alongside with other UIA members, did a Bethlehem Haven Women's Shelter drive.
COVID care packages were developed by most of these kids to provide for shelters, as well as sanitary hygiene was provided, menstrual hygiene, education to adolescent girls, and along with Global Pragati, we were able to provide sanitary napkins to adolescent girls. And at this time, realizing the need for PPE in Mumbai during the COVID pandemic, Ekam Arkansas has actually done a mindfulness webinar workshop to raise funds and donate this. And successfully, you can see that these funds were provided much needed PPE in Mumbai. And this is the Ekam Foundation's work in India for the Ekam USA support for all the chapters for the COVID relief that was done. We've tried to take care of the artists that don't have jobs, elderly patients, kids affected by COVID. And each chapter, like Seattle, has taken care of Hero District grocery donation. And you can see different chapters supporting the different districts. The homeless population, as well as the equipment for the hospitals in their districts were provided by each of these chapters. You can see the multiple chapters that have done projects during this time. And along with the partners, Cognizant Foundation and ICAR, as well as Give India, Ekam Foundation was able to provide this $1.2 million PPE effort across 6 states. So we are so thankful for this partnership. Now, we did not forget our regular activities, and these are the children that actually had hearing implants, but could not afford the battery support for them either. So Ekam was able to raise funds, and we continue to support the medical treatment for children, as well as equipment such as oxygen monitors, suction systems in the hospitals that were being overwhelmed during COVID pandemic, and provided equipment as well as maintained the continued monitoring and treatment of mothers in need. and each chapter raised their own funds, and Caring Crowd is the platform that you will see. So what have all these kids have done with this? They have been recognized for their volunteering hours through the President's Office. 44 volunteers have done 5,500 hours across chapters by working for tutoring, mask making, and different kind of activities that got them hundreds of volunteer hours. And all of these kids, we are so proud of them for achieving this. These are some of the benefits you can get. And now we will move on to Aruna Vatsavai for her to be able to give well, I think we kind of, she may not be able to join, but we have the finance update here. Since 2016, as I said, we've grown exponentially. You can see the numbers going up. The first bar is the funds that we've raised, and the second bar is what has been sent to India for the work that's being done there. And we are proud to say, due to Aruna Vatsavai's work, we can say 100% of our work is done voluntarily, and she counts every penny that comes in and comes out. And we are able to send all of your donation, 100% of your donation to India. And in 2020, you can see because of COVID, we've seen such generosity and all this work only able to be done because of the volunteers and the donors. And we have sent most of these funds, and you see the big difference is because we were able to do a ton of activities locally in the USA for COVID relief. That's why you see the difference in the funds here. And I would like to recognize every single donor that has done this for us. Whether it's $1, $10, $20, but our grant ambassadors deserve a special recognition. Dr. Usha and Amar Ramaneni from Ekam Pittsburgh are the grand ambassador level of $10,000 a year, and we truly appreciate you being with Ekam all this time and continuing to support us by doing local fundraisers, increasing awareness about Ekam in your community, and supporting us. And Drs. Kiran and Shankar Sanka, we are ever so thankful for your continued support to Ekam as well. We have been able to do a lot of work with your support. And Mr. Nick and Mrs. Yuling Panyamurthy, you have been with us and inspired by Dr. Sai's work, and you have supported us as a grand ambassador. Thank you very much. And sustaining grand donors, Dr. Uma and Mrs. Sita Varanasi from Ekam Bakersfield. You are been such a motivation and inspiration for us to continue doing this work with all your support and unquestioning belief in what Ekam can do and connecting us with more donors and volunteers. So this is a shout out for everybody out there to please join us in this effort. A special thank you to Mr. Venkat Padi from IQVIA for providing a $10,000 grant to Ekam through his company by promoting Ekam and its work and obtaining this for us. This grant is being used for a livelihood project to provide livelihood for different kind of activities that are being done in addition to medical support by Ekam. So please visit our website at ekamusa.org and donate to Ekam is a URL you can use, and you can support us for all of these activities and more. A sustained donation of $20 a month or $31 a month, $1 a day, or any amount every month is of course valuable in providing support to all of these continued activities. You can even do Amazon Smile, and there are different options that you can have to be able to do this. And of course, ekamonness.org is the Ekam Foundation's website. Again, based on the values of Ekam, and self-obsolescence is losing one's identity, and Ekam is oneness. So we all come together in making this happen. So we need your support as volunteers. You can join us as a youth volunteer with this tiny URL at Ekam UIA, or as an adult volunteer, whatever your talents are. We would love to do that. Now, all this could not have been possible without the Caring Crowd that you heard so much about. The platform by Johnson & Johnson is a crowd sharing platform which does not charge fees and actually gives us matching. So we have been able to do double the work from your donations because of this partnership with Johnson & Johnson, and which takes us back to our next speaker, John Brennick.
Hi.
Oh. Well, you're going to have an introduction, of course.
Oh. Sure. 1 second, sorry.
Yes, thank you so much, Dr. Nilima. The Ekam USA has done so much in, raising funds, and, we've seen the effects that it's had in India. I'd just like to thank you for being part of that as well. So our next speaker is Mr. John Brennick. Mr. John Brennick is the co-founder and leader of the Caring Crowd organization, the crowdfunding platform for global public health provided for free by Johnson & Johnson Global Public Health. John is a native of Boston and Germany and studied finance at Wharton and strategy at Yale. He brings to bear more than 25 years of entrepreneurial, nonprofit, and global healthcare industry experience. He is passionate about innovation and access to healthcare for everyone in the world. Now let us welcome Mr. John Brennick to deliver his address.
Okay. Hello, thank you for that introduction. I want to be sure to mention I am very honored to be involved with ACAM and all the ACAM teams. You are very energetic fundraisers and are truly global change makers. You really are leaders. You're changing lives. Most of you are familiar with Caring Crowd, and many of you have become genuine experts using Caring Crowd successfully. Caring Crowd, as mentioned, is the crowdfunding platform for global public health made possible by Johnson & Johnson. When I co-founded it as a Johnson & Johnson employee, we were immediately backed by senior management of Johnson & Johnson in order to follow the Johnson & Johnson credo. One of the things the credo says is to support health in communities locally and around the world. And when we launched Caring Crowd, we dreamed of nonprofits like ACAM, leveraging it to improve the health and lives of those in vulnerable situations and to build healthcare capacity. And thanks to ACAM, this dream is being fulfilled. ACAM, you are a key partner of Caring Crowd. You are actually driving some of our continuous improvements of the platform. I point to ACAM as an example when I tell others how best to use the platform. So you should know that your influence, your innovations, and your impact go even further than you were probably aware of and that you can keep track of. And you should definitely be proud of all your achievements, even on Caring Crowd alone. You soon will pass the $400,000 total raised on this platform. I'm honored to be a part of ACAM and continue to see how you feel. I continue to see and feel how you live up to the guiding principles of ACAM. So in the first slide there, you can see I include a picture of Nalima as an example of a project owner. And there are so many of you who have been project owners. I could go on and have many, many slides. And yes, on this slide here, I'll just mention it was an honor and pleasure to meet Sai in person. And it continues to be an honor and pleasure to work intensely over a long time with Nalima, an incredible partner in making good things happen, a real doer. And I've met many of you electronically, and we've been on internet interviews together. So what I tell many others is that Ekam gives us faith in humanity. Please keep it going and growing. Thank you for all you do.
Thank you, John.
Thank you, Mr. Brennick. Obviously, Caring Crowd is a huge part of what ACAM does, and we do many fundraisers and activities towards through Caring Crowd only. So thank you so much. MCs, could you please introduce the next speaker?
Dr. Hari Ipanopoulos is a financial services professional with over 30 years of experience, working in different roles with major Wall Street banks, Credit Suisse, Merrill Lynch, BlackRock, and Bank of New York Mellon. He is a visionary and entrepreneur, keynote speaker, mentor, and philanthropist with a passion for healthcare, education, and the environment. Dr. Hari Ipanopoulos is the founding chairman of the Lead India Foundation, which is founded with the inspiration of Dr. APJ Abdul Kalam, the 11th President of India, with the mission to provide affordable quality healthcare, affordable quality education, preserve and protect the planet for future generations, develop spiritual families to establish peace and harmony in the society, and finally transform youth into responsible citizens and engage them into developing the nation. Now let's welcome Dr. Hari Ippanapalli to deliver his address.
You're on the mute, Dr. Hari. Sorry.
Thank you. Thank you very much for inviting me for this August gathering of the first global webinar of Ekam. I've been myself associated with the Ekam from the beginning, thanks to Dr. Dakshinamurthy, uncle of Sai Lakshmi, who introduced me to Ekam, and I worked very closely with Nilima to set up this foundation. And I'm very happy to see that the growth of the organization with 20 chapters around all over the US, and also connecting each chapter with the district adaptation, which is very amazing work Dr. Nilima and her team did. Very congratulations to all the people who are involved in promoting Ekam. And again, congratulations to Dr. Sai Lakshmi for her vision and also her dedication to sacrifice her life to transform the lives of many children and mothers. Again, friends, good morning and good afternoon and good evening, because we have people from all over the world. And friends, the COVID-19 pandemic continued to impact the lives of millions of people around the world and the global healthcare, education, economy, and employment due to restricted mobility. Again, the UNESCO estimated about 1.5 billion students around the world are affected since their schools and colleges are closed. If you look at today's numbers around the world, about 46.5 million people are affected, and over almost over 1.2 million people are dead, and especially in the US, over 9 million people affected and 236,000 people. In India, about 8.1 million people, 122,000 people dead. So these are the numbers, very mind-boggling, and very scary numbers. Ekam is playing a key role in providing the PPE kits, as well as providing all the related guidance for protecting themselves from the COVID pandemic. Again, I would like to sincerely thank Ekam for doing such a wonderful job. Again, the pandemic has created an opportunity and an undeniable challenge as well. This may require partnerships between institutions of developed and developing countries to share knowledge and resources, and Ekam is an example of such partnerships. Again, Dr. Sai Lakshmi was referring to United Nations Sustainable Development Goals, and the goal number 3 happens to be good health and well-being. And to achieve these 17 sustainable goals, SDGs, by 2030 requires partnerships of governments, private sector, civil societies, and citizens alike to make sure we leave a better planet for future generations to live. United Nations projected that it requires about $5 to $7 trillion annual investment to implement the Sustainable Development Goals. As you all know, the pandemic has really impacted the global economy, and the countries will not have the money to support the United Nations Sustainable Development Goals. And it's time for us, like Ekam Foundation and the corporations like Johnson & Johnson and other NGOs and individuals like all of you who contributed to this cause, have to partner to make sure that we do not leave this planet with unhealthy conditions or unlivable conditions. So we still have about close to 1.3 billion people live in multidimensional poverty. About 1.6 billion people live in fragile healthcare settings. That's where Ekam is focusing on. And every 2 seconds, someone aged 30 to 70 dies prematurely from non-communicable diseases. And over 103 million youth worldwide lack basic literacy skills, and more than 60% of them are women. So these are the number of things that are happening in the world. So the Lead India Foundation is humbly making an attempt to bring the stakeholders to collaborate and work together by organizing Sustainable Inclusive Development Challenges and Opportunities Conference, focusing on healthcare, education, environment, peace and harmony, economy, employment, and empowerment of youth and women. We recently did one global webinar over 37.25 hours traveled over 47 countries digitally, and established chapters of LEAD Foundation around the world to collaborate partnerships to promote the sustainable development goals in providing affordable quality healthcare, education, environment, peace and harmony, economic development, and employment generation for women, youth by partnering with NGOs, governments, large corporations, heads of states, and share the problems and possible solutions. And Lead India also launched an innovation challenge for providing solutions for these 7 different areas. And if you could visit www.leadindia.us and submit your idea, and we will be able to coordinate with the like-minded corporations, NGOs, and government agencies to fund your idea to take that into a product or a service to implement on the ground. And we are proud to have associated with Ekam right from the inception, and will continue to do so to roll out some of the best practices of Ekam to other parts of the world as well. So I would like to again thank each and every one of you. And because of your support, Ekam is able to provide the necessary care for the children and mothers in India. And also the kind of support you provided during COVID-19 in the US is amazing. And again, congratulations and the best wishes to all of you. And please stay safe and continue to provide this humanitarian service as needed. And your motivation and inspiration goes a long way. And looking at the numbers, I think the amount of work Ekam has done in the last 7 years is amazing. Congratulations and kudos to all of you. Thank you so much.
Thank you so much, Dr. Hari. Yes, with the leading the organization, and obviously, yes, you've been a founding member since the beginning of the Ekam, and you've been a very important person throughout that time period. We now have MCs. Can we please introduce the next speaker?
So, Mrs. Rajeshri, or yeah, Mrs. sorry.
Ms. Anupama Gotimakula.
Yeah, sorry. Dr. Anupama Gotimakula is an anesthesiologist in San Antonio, Texas, and has over 24 years of experience in the medical field. She graduated from the University of Health Sciences, Kakatiya Medical College Medical School in 1996. She's affiliated with medical facilities, Methodist Hospital and St. Luke's Baptist Hospital. She's also the president-elect of the American Association of Physicians of Indian Origin. Let's welcome Dr. Gotimakula as she speaks with us today.
Thank you for that kind introduction. And so I live in San Antonio, and I came to know about Ekam USA, Ekam Foundation 4 years ago. I met first time Neelima in Dallas, and that's how I heard about Ekam USA. And then I met Sai. Hi, Sai. And so she came to my house, and we did a fundraiser in a small way first, and then we did another fundraiser in San Antonio. So the more I hear about Ekam Foundation, and the more I get, it's very touchy to hear about the stories, what I heard from Sai, how the kids in India, very, very poor healthcare. So that motivated me to involve in Ekam Foundation. And I'm so impressed, Neelima, hearing your report and the way you're all doing. It's amazing, amazing to hear that. And so I'm president-elect of American Association of Physicians of Indian Origin. This is a large organization in United States. There are more than 100,000 Indian physicians here in United States. So this is the voice of Indian physicians in this country. So we always discuss about how we can help Sai Lakshmi in this good work she's doing. And so I would like to get more and more involved and see how API can help in this fundraiser and support these kids who are really in need of health care. And thank you, Nilima, for introducing me to Ekam Foundation. And I wish good luck to every member in this Ekam Foundation who have been putting their selfless efforts and doing such a great service to human and mankind. And these are the babies who have a future. So this is where we should put our efforts into. I'm a pediatric anesthesiologist. I get babies who are premature starting from 21 weeks. So when I see them, some of the mothers cannot take care of these babies here in United States, so they go under foster care. So we have certain system in United States, but in India we do not have that system to support these premature babies, or or they cannot afford health care, so they are thrown away. And so it's pathetic to hear these stories. And we should change the system. So whatever I can do from my side and from American Association of Physicians of Indian Origin, and we are here to support you. Thank you so much, and please continue the good work. And once I finish this organization leadership, I think I can put more and more of my time into ACOM, and we'll continue the journey with you. Thank you so much.
Thank you. Yes, obviously, you are a very big contributor to the Ekam organization, and we sincerely thank you from the bottom of our hearts. So we now have our Ekam UA team. We have first Dr. Preetam Bodhana, a consultant and nephrologist of general physician at Gloucester Hospitals and NHS Foundation Trust. Fundraising and running marathons are his hobbies. We also have Dr. Rajani Lalnuri Somachi. She is a dermatologist specializing in pigmentation and cosmetics and works both in the private and public sector. And she was inspired to join Ekam's cause through Dr. Sai Lakshmi. And then finally, we have Dr. Ajay Kotagiri. He is a consultant ophthalmologist specializing in retina and inherited retinal diseases, working in the northeast of England, Newcastle and Sunderland, and is a funding member of Ekam UK. Now let us welcome Ekam UK to present today.
Dr. Rajni, you're going next. You can unmute yourself.
Yes. And if I can have the slides, please, Samir. Hi, everyone. I'm Dr. Rajani, and I'm honestly honored to be this global webinar of Ekam. Today, I'm going to briefly introduce you to Ekam UK. So it was set up a couple of years ago, and it was sharing the same vision as the Ekam Foundation in India, with an aim to provide and support healthcare for every child and expectant mother, and also to support research, training, and partnership between UK and India. Next slide, please. So our objectives are to fund and support Ekam projects in India and also similar organizations in the UK, and also to partner with other organizations of Indian origin within the UK to raise awareness of Ekam within the UK and also to increase membership. Now, it was not easy to start off and to set it up. So we faced some challenges. Initially, to start off, registration with the Charities Commission took a lot of time and effort. A huge credit goes to Mr. Vaikund, who has not been able to join us today. And next slide, please. And then it took some time to get the trustees involved. People were a bit hesitant to come forward initially, especially many were concerned with regards to the medical legal aspects in this country. But eventually it started off with 3 trustees. And also it took time for the HMRC to approve these trustees are of good standing and allowing for tax exemptions. Next slide, please. Then the next step was setting up a bank account with the charities, which took some time, and also obtaining gift aid from the HMRC. Then we built up a website and social media profile. So Ekam UK is mainly looking for guidance and support, most likely from Ekam India, Ekam USA. We are relatively new and open to ideas. We'd like to start off with realistic, achievable projects, set up Friends of Ekam and youth ambassadors similar to the USA. Our strengths lie in our expertise, and that we're relatively new, so are open to ideas and changes and suggestions. Thank you. Next slide. Thank you.
Hi, this is Ajay Kotagiri. I'm happy to say good afternoon from England. So as you might have heard from Dr. Rajani, we are very young, and we've just started Ekam UK, and it took a lot of challenges to begin with. but we are here and we are ready to go. Some of the challenges we overcome very easily, but we could not help, troubled by COVID like everybody else. We started with a very small group of people, small events to begin with. We had individual donors and we raised a couple of events with few £100. But we had a kind of a breakthrough and we had a major push recently. We partnered with an organization called the Northeast Telugu Group. Next slide, please. So in the COVID lockdown, we were very worried, but fortunately, all the Indian families we meet in Northeast, the Telugu people, we were looking to raise some funds for India. And so one of the group members, Dr. Suresh, got hold of Dr. Sai Lakshmi and her work and come in touch with the Ekam's work in India and decided to partner with Ekam UK to raise money. And this program has been really successful. 32 children participated in it. They took up different sporting challenges. They challenged themselves and raised £9,000. They've now become official partners and we've learned quite a lot from this activity. We'll look forward to working with NETG further and also create more local partners and official partners. And all the children, next slide, please. All the children have now become part of Ekam, Friends of Ekam group. We would really like to learn from Ekam USA in implementing Youth Ambassador program. And the children currently who participated in fundraising were really enthusiastic and energetic. And this energy, I hope, continues and we continue to provide support. And please see the video that was created from Dr. Bindu and Deepthi, who've been instrumental in running this program and helping it. We are finalizing the support that this program will do in India. Currently, we're looking at projects funding phototherapy units in local government hospitals in Hyderabad, which will be a local connection to people who have raised the funds. Thank you. Can you play the video now?
Hi, in the troubled times of COVID pandemic,
to help people in need, we, the kids of NETG North East Telugu Group,
Came together to do a sports challenge.
to raise funds in aid of Ekam Foundation.
In different sporting activities like cycling, running, skipping, walking, etc.
We worked hard over a period of 1 month.
And we reached our target successfully.
With lots of support from friends and families,
we managed to raise £9,000
to support the Ekam COVID campaign.
We enjoyed it very much.
Yeah, we had so much fun.
We hope to continue this in the future.
If we could do it in our own time,
every one of you can.
And Dr. Preetham, you're next.
Namaste. Thank you. And I'm really sort of indebted to everybody for giving me this opportunity. I think I'd like to start off with my first slide. Just to reiterate to all of us and also to those who are following us on YouTube, the vision of Ekam, which is healthy and happy children with for the mothers and the communities. We all share the same mission as well as the values of Ekam. Next slide, please. For me and for all of us, life is about reflection and learning. I think in this last sort of an hour and a half, looking at all the slides, both from United States, USA, from what Neelima and her team have done, and also what Ajay has shown and Rajini, I think there's a lot we can learn from what is already being done in both in India, such as collaborating Ekam with some other Indian charities like Abhayam, and also looking at all the fundraising and the sort of the social and the cultural activities that are taking place. Just like in United States, I think even in United Kingdom, what we have done is to get the Ekam UK registered, we have to go through the charity donations so that we can get the tax relief. Next slide, please. I think before COVID, this is a model of sort of where we can sort of look at how the charities could be looking at volunteers, people with like-minded sort of ideas to sort of help people in need, looking at fundraising events within our own sort of societies, as well as locally, as well as nationally, looking at selling products, for example, like the PPE in this time of COVID, sponsoring events, and also advertising to bring in more tax donations. But after COVID, we can see that we can't do the fundraising events because, as you may have heard the news, England is in the second national lockdown as of from the next 3 days. We're going in for 4 weeks of national lockdown. So we can't be doing any fundraising events or doing any sponsoring events. Next slide, please. So I think my message is, but in UK as well as across every region, is I think we shouldn't cancel our campaign. I think we need to adapt and change to the challenging scenarios and the unprecedented times we are all facing. And this is not a problem that is localized to one part of the world. It is estimated that nearly 50% of the funds will be lost by charities. I think we need to be innovative. We need to look at our own fundraising sort of projects, and there are some ideas which what as Neelima and her team have shown from USA, which we could adapt here in UK. And rather than reinventing the wheel, I think we could look at those projects while we are in this unprecedented time. And also, I think during this time of crisis, we have connected with our family and friends through Zoom or through Teams or many things. And I think we can use this as an opportunity to organize more sort of social connecting sort of and connecting with friends and families and raising funds through social media. And I'd like to conclude by saying is, I think from what Sai and her has started, I think this is about right care for the right people. And I believe not just in UK, but all over, whoever is connected with ACAM, together we can change for a better world. Thank you.
Thank you so much. Yes, Ekam UK is a relatively new group to in addition to the Ekam organization, but we still are, there's so many ways to go, and we expect very, very high hopes from you. So can we now introduce the next team from the Ekam Canada, Dr. Rama Koneru. Could we please introduce Rama Koneru?
Dr. Rama Koneru is an internal medicine doctor in Ontario, Canada, specializing in internal medicine and medicine oncology. Dr. Koneru is registered with the College of Physicians and Surgeons of Ontario and completed her education at Gandhi Medical College in 1998. She is currently practicing at hospitals such as Lakeridge Health, Oshawa General Site in Oshawa, Northumberland Hills Hospital, and Coburg District General Site in Coburg. Dr. Koneru is also the president of the ACOM chapter in Canada. With that, we would like to welcome her now.
Thank you for that introduction. Thank you so much. And I'm really proud to be part of the ACOM group here, really inspired by Sai and Neelima and their commitment to the goals of ACOM. Similar to ACOM UK, we are a young organization. We started in 2017. We're still a nonprofit organization. Our charity status has hit a bit of a snag. The rules here are a little bit more stringent, but we'll continue to strive for that. We've had several fundraising events over the past couple of years, although this year we've kind of taken a break with everything that's happened with COVID. We've still managed to do a couple fundraising with private at-home events and also a face mask project. So we've done smaller events and hope to do a few more next year. Apart from Ekam, we are also supporting an organization called POGO, which is Pediatric Oncology Group of Ontario, and also Solus Eye Care in India. And I think our challenges are similar to what UK has kind of mentioned already. So we're really looking forward to learn more from what Ekam USA has done. I think today has been really inspiring for me anyways. So those will be ideas moving forward. Thank you for allowing us to be a part of this.
Thank you. Yeah, Ekam Canada are the Ekam USA neighbor. And, we really thank all of the Ekam branches, especially because, without you guys, we can't really get the funds for anything, right? So, I mean, taking this all over the world is not only gaining exposure, but it's also, having more youth to be involved in this, and that's going to be inspiring for generations to come. So I'd just like to thank all all Ekam members today. Could we please move on to the next speaker, which will be Ms. Subhashri. Ms. Subhashri is a healthcare professional with more than 10 years of experience in the medical devices. She has a special interest and passion towards moving and working for maternal and child health, currently supporting Ekam and Academy outreach and resource mobilization activity. Now let us welcome Ms. Subhashri to deliver her address.
Yes, Subhashri, you can unmute yourself and share your screen.
Yeah, hi. Thanks, Amit, for the introduction, and I'm glad to be here. Very inspiring to see the journey of what you guys have done globally. And in the next few minutes, I will run through the India operations and the activities that we do in India. So, can I share the screen from here?
Yes.
So each year around the world, more than 6 million children die before reaching the 5th birthday. And these deaths can be avoided through preventive approach, which is through the knowledge and infrastructure upgradation by raising awareness on various aspects of health and well-being in the community on maternal child health and engaging them in a holistic approach to help them make informed choices. And the other one is a curative approach where we support in providing emergency and life-saving medical support. And as UNICEF quotes, 70% of early child deaths are due to conditions that could be prevented or treated with access to simple and affordable interventions. And we would be able to make it more sustainable and workable when we do a collaborative partnership. And this is being worked very well for Ekam, where we have been very successful in joining hands with a lot of private sector, public sector, civil society, and community, and had been glad in making great partnership in this journey. Today, Ekam Foundation works in 7 states of India across many projects within reproductive, maternal, newborn, child, and adolescent, with a view to do a holistic reduction in infant deaths. A model for Pan-India is what we're all talking about on the Sustainable Wellbeing Initiative, which helps in reducing neonatal and maternal health. And more about the model, I will brief on the coming slides.
Subhashri, can you turn on your camera? Maybe you can stop sharing the screen and you can just read out so that we can see you on the screen.
Yes, sir. My bandwidth is pretty bad, so that's the reason I've just turned it off.
No problem. Please go ahead.
Yeah. Thank you. So through our extensive network, Ekam receives regular requests from immediate life support from different parts of our network, which include the trained nurses working in more than 1,000 plus primary and community health centers, who along with the support of multiple people such as biomedical engineers, Anganwadi workers, volunteers, community health workers, identify these children from, on the urgent needs, which comes to us for the treatment support. And we have a dedicated helpline number through which these requests for support are received. I will play a small clipping of the children that are being treated.
So Vashri, can you make it full screen, your PPT?
Yeah. So all the children that have been treated are growing up healthy and happy, and we thank all the donors, hospital staff, private and public health system who've helped us in this process, and to all the network who've reached out to us, because it is an opportunity for us to support them through you. Thanks for all the supports you've been providing to Ekam, and it has made a huge impact in lives of so many kids and families around. And these activities are supported for children who are between the age of 0 to 19 years, who basically suffer from various life-threatening complications such as cardiac illness, kidney ailments, and so many other aspects. And the scope of this project extends to providing support like emergency care, hospitalization, drug support, investigation, and so on. And we've been getting these support from 38 districts of Tamil Nadu, and we've recently been getting multiple supports and requests from other parts of the country as well, from Andhra, Karnataka, and West Bengal. And all of these children are basically followed end to end from the time they get admitted, basically from screening to admission to discharge. The entire growth cycle of these kids are being followed by our district coordinators and staff. And other than this direct medical support and activities that we are doing as a part of Save a Child campaign, Ekam in collaboration with various state governments have recruited staff nurses at various levels of health systems, starting from medical colleges to primary healthcare centers. And Ekam also has been very instrumental in making up the working uptime of the equipment, which was working at 14% in many of the government hospitals to 98% by directly impacting so many lives of these children who have been admitted in the neonatal intensive care units. Other than that, we've also been doing multiple level of community health activities, and we've done more than 40,000 plus awareness programs in Tamil Nadu, and we're also starting it across the different parts of India. With all of this, we are so proud and happy to say that we've touched more than 1 million lives in last 10 years through various activities that have been conducted on this journey. And we're trying to make it much better in the coming years to come, because every life matters. This is something which Dr. Sai spoke about on creating sustainable community at grassroots level, because we wanted to create a permanent solution as an organization. We don't want to just work on projects, do something temporary and go off, whereas we wanted to create a process that kind of works on its own. So that's the reason why Ekam does a lot of activity at the community and grassroots level. Through various programs. Maybe I'll show a small clip of activities that we do as a part of a sustainable well-being initiative through a video. So I've highlighting few activities such as ensuring early identification of children. This supports an on-time referrals through various camp settings that we do in different parts of the community, which supports in direct reduction of preventable deaths, and thereby helping them to be getting treated on time. Other than the medical camps, we're also running a lot of awareness programs in the community and supporting and upbringing the health literacy for these mothers and people in the community. And various capacity building of village health staff through kitchen garden and herbal garden, which you see here, are done in various community schools, which has a direct impact to these food which these kids eat. We try to grow a lot of homegrown food in multiple villages and community, which kind of has a direct impact on the nutrition. So these are few activities that we've been doing as a part of a sustainable well-being initiative, and training volunteers and youth is one big piece of work that Ekam is trying to do, and trying to create a mentorship model within the community, which will have its own sustainable, once it has been set. engaging the right partners, as I already mentioned, Ekam has worked closely with many state governments across India and in various projects, including recruitment of staffs and government hospitals at various levels. We've been involved in building mentor nurses training program in Tamil Nadu. We did a lot of programs in maternal and child tracking in different parts of the country. And Ekam has also been involved in various primary healthcare assessment and needed support through the donation that has been raised by our global chapter. So many other projects that have been well appreciated and accepted, and these projects will also be taken up in a policy level. So that is the amount of success we've been able to mark in our journey with our activity in maternal and child health space. So the UNICEF project that we are currently working in Tamil Nadu is a blend of community and facility activity that we are doing. And we are working across different places in Tamil Nadu to ensure uninterrupted essential services of reproductive, maternal, neonatal, child health, and adolescents, including immunization service, home-based care and support, and also working on doing a lot of community level referrals through the mentor and the volunteering system that we have developed in the state. And through this program, Ekam is working a lot on community level interventions to bring in convergence, which Dr. Sai quoted. And with the support of state government and UNICEF, we are working on this mentorship model, which is creating a sustainable, which will also create a sustainable health outcomes to various programs, which includes capacity building, where so many organizations have come forward to partner with Ekam on multiple aspects to support the state during this COVID scenario, making them as change makers in the community to support awareness of maternal and child health programs. And these health volunteers are also helping in timely referrals of these high-risk pregnant mothers and also supporting us in multiple child referrals from the community. And this program is ongoing, and we've been able to reach out to multiple pregnant women and support them in all possible ways we could. More on the project, I have Mr. Kaushik from UNICEF who will be highlighting on the key areas and the outcomes on the coming slide. So this is something which I wanted to end the note with. We all know that women, children, and adolescents are the most powerful agents for improving their own health and achieving prosperous and sustainable society. And as an organization, Ekam is working towards that. And we would welcome all of you to join this wondrous movement. Thank you so much for the opportunity.
Thank you so much. You know, it's always amazing to see how the impacts of what we do in the overseas chapters and see what's done in India and see how it's impacting and the way that people over there do it, because it's a different process in every country and every region. So thank you so much for providing us that insight. We now have our next speaker is Mr. Kaushik Ganguly. So could we please introduce Mr. Kaushik Ganguly?
Kaushik Ganguly is an expert in public finance, health and nutrition financing, climate change, and research capacity building in developing and less developed countries. In his more than 15 years of experience, Kaushik has led economic research in the area of assessing health systems, health financing, fiscal federalism, public expenditure, accountability, and managed cross-country collaborative research projects in more than 40 countries around the world. Now let's welcome Mr. Kaushik Ganguly to deliver his address.
Thank you, Shreya, for the introduction, and thank you, colleagues from Ekam across the world for bringing all of us together. It's really fascinating to see how you have been engaging youth volunteers and young people in different locations to bring about changes within the community, within their own community, and across the world in India. This is really important. The Ekam model is really pertinent and important in current times, because talking about holistic well-being is what we what we see its need increasingly in the current days, because we have seen that the current crisis of COVID-19 has brought about a multifaceted challenge in our society. We are seeing people not just falling sick, but we are seeing also indirect impacts of it. Family members of sick people being stigmatized, or losing their jobs, having to migrate from one place to another without adequate social safety nets. Uh, Access to healthcare being diminished, because we are seeing that a lot of public health facilities in the country being devoted to COVID care, and therefore a lot of the poor and marginalized people who access these public facilities for low cost care are not able to do so because they are afraid uh, of contracting COVID at these facilities, and in some cases, the non-COVID essential health services not being available at all in these places. So the challenges are really multifaceted, and we are also seeing a lot of people slipping back into poverty because of increased healthcare costs, loss of job, loss of livelihood, and what I would really like to highlight here, that the challenges are really multifaceted, and the issue of holistic well-being over here is really important. And in this regard, the initiatives that Ekam is undertaking in terms of uh, infusing sustainability initiatives at a very granular community level, whereby young people are taking initiative and finding ways to make their communities more resilient through unilateral action, community level action, or philanthropy. These are really important practices to inculcate in the youth in these days, actually. And I really congratulate Ekam across the world for taking this forward. What I would also like to highlight here is the importance of working at a more systematic level, where uh, community level actions can be made more sustainable, and this can be made more sustainable to uh, do bottom up work towards more policy driven, more sustainable solutions, where the community level initiatives can be sustained over a period of time, and this can be brought to a critical level where they take on pace on their own, not and does not need pushing by one or a collective of organization, and it takes a pace of its own. It's an important area that needs more focus and initiative. And I would urge Ekam to look in that direction as well. And in this regard, actually, Ekam is also helping us. We partnered with Ekam in this regard to do a lot of to help us in providing community level support in terms of tracking of pregnant women, lactating mothers who are facing difficulties in the current context, to provide that support system that is missing. But in addition to that, we are also partnering on important technical aspects of work, building, trying towards improving quality of care at the facilities, improving knowledge about guidelines and technical aspects of COVID adapted programming, if I may say so, COVID adapted programming in the states, because a lot of our traditional way of working has changed and has to change in this time. So we are all trying to adapt in this regard. And Ekam is doing some important work with us in this area as well. So I'm really happy to see you all. And once again, congratulations to what Ekam and all of you together have achieved so far. Thanks for this opportunity to hear you out and to speak in this forum. Thanks from my side.
Thank you so much. Yes, you've given us a very opportuneful insight to see what the UNICEF has been doing and seeing what's happening in different countries as of right now. So thank you so much for that. Mr. Ganguly. So now can we have the next speaker be introduced, please?
Yeah. So thank you for all that information and all the hard work and effort you guys have all put in. It's very admirable. Next, I'd like to introduce our next speaker, Mrs. Rajeshri, who's an IT industry veteran and a social impact leader with nearly 30 years of global experience. She obtained her master's degree in electrical engineering from Indian Institute of Technology, Kharagpur. Mrs. Rajeshri is also a Six Sigma Black Belt, which means she's a professional who can explain Six Sigma philosophies and principles, including supporting systems and tools, and she's also a certified executive coach. Currently, she's the Chief Executive Officer for Cognizant Foundation and plays a key role in involving an overarching charter for the foundation, defining CSR strategy and goals, managing operations, communication relationship with a broad set of diverse stakeholders. With that, let's welcome Mrs. Rajeshri to deliver her address.
Thank you, Ananya, for that wonderful introduction. First of all, I would like to congratulate Dr. Sai. Sai, what you started as a seed initiative, with a great vision and a very clear purpose, and of course driven by dedicated efforts. And I'm happy to see that it's gathering momentum with many, many inspiring volunteers joining hands with you now across the globe. And I'm so happy to see the volunteering spirit. Of course, I come from Cognizant family, a company which has leveraged the power of employee volunteering to the maximum to drive a culture of purpose. Just to say that, Cognizant launched our volunteering movement in 2007, and we've clocked about 3.4 million hours of volunteering with 200,000 volunteers. I'm sure that Ekam, US, UK, and Canada put together, you can actually, just surpass those numbers. And I'm happy, with outreach volunteers volunteering from 29 countries in 37 cities, impacting about, I'm sure that I wish Ekam actually take on big in this volunteering journey. Coming back to foundation, it's about 15 years old organizations, and our association with Ekam goes back 11 years. We started our association in 2009. Of course, CF focus a lot for providing quality access to quality healthcare, education, and livelihood opportunities for the underprivileged from remotest parts. And how we do it, we very clearly wanted to have a very clear, sharpened focus. And we work on programs with very clear, defined objectives. And of course, we partner with very, very credible partners who kind of aligns with our values and work for those objectives. And why definitely we want to maximize our impact because resources are always a constraint across the world. But if you put it to use, properly, efficiently, and definitely we can actually maximize the impact. And we want to maximize the impact and the outcome for all the efforts that we put in, and as well as all the efforts that our partners and volunteers like you put in. So that's exactly what we do. And we focus on a couple of areas, healthcare, education, and livelihood. Let me talk about healthcare, particularly for this. We focus on two major areas there. One is preventing avoidable blindness, obviously because India has such a large burden of blindness and vision impairment. Globally, about 39 million estimated globally to be blind, and India has a share of 12 million blind people. And particularly 75% of that is avoidable, which means it's preventable. So that's what actually touched us, and we wanted to focus on that. And with all our programs across 9 states, we've touched about 1.6 million people through our preventable avoidable blindness and vision impairment program. And our another major focus area is women and child health. We know that the vast majority of maternal and child health that occurs, despite all existing known and affordable treatment for a variety of reasons. One, awareness, accessibility, and so on. So we started with the goal of to improve the access and quality of basic healthcare services of women and children. And we've been supporting a variety of programs through the underserved women and children, particularly focusing on reducing infant mortality, maternal mortality, and as well as infant disability. Here again, it's not just about preventing blindness. We also want to prevent all disability, and particularly earlier the better, because definitely that's going to prevent the disability for the life. And we've benefited about, we've actually touched about 7 states with about 300,000 people, particularly in this program. And with Ekam, we specifically, Dr. Sai mentioned that the reason why we selected Ekam is that for all our programs, we follow the OECD's ways of looking for relevance, looking for coherence, looking for efficient implementation, effective implementation, and more importantly, sustainable impact. And if you have to actually create that sustainable impact, the community participation is a very, very big thing. And Ekam, like, I know I really appreciate, how you kind of try to make the community participate. And some of the programs that we've worked with Ekam, we're very clearly, we're focusing on government systems and public healthcare systems. Because that's where you can really maximize your, your efforts. And some of these programs like RBSK program, that we talk about for preventing disability, the program is started, the policy is good. Mr. Ganguly talked about policy and systemic interventions. The policy is good. It starts with all the good intention. But somehow it's a very last mile, few things are missing and the effectiveness go down. And that's where I really liked about Ekam, because you go back, work with government systems and exactly identify that small delta that is missing. And just plug that in so that the overall, systemic efficiency kind of goes up. And that's exactly what we look forward for partners like Ekam and Dr. Sai and the team, been doing a wonderful job of working along with government systems and looking for those small gaps. We started with, like in 2009, with a very small grant, actually for for variety of things like small equipment to setting up a complete high dependency unit for Institute of Child Health and EGMO and so on. And a lot of equipment for special new carbon units, blah, blah, blah. But then we really like the way in which you have grown. And we are looking forward for this program for starting a new project for District Early Intervention Center. I think the COVID pandemic played some spoil sport there. But nevertheless, you also helped us for the COVID-19 as well. Like in the time of crisis, we have many unsung heroes, the doctors, nurses, and a lot of other workers, healthcare, police officials, and so on. And I think given our focus in healthcare, and particularly with public health systems, a partnership with Ekam, we wanted to actually go and reach out to those institutes. We actually we partnered with several partners across 9 states. So we reached out about 70 plus institutes to providing all that protective gears and small equipments again there, which were missing. All the bigger ones gets noticed, but we realized the smaller ones were always in short. And with Ekam, actually, I think we were able to service for 5 different states across India. And really, thanks a lot, Ekam and team. And I think I have to take this opportunity to wish all the Ekam ambassadors in US, UK, and Canada, and particularly please pass on the wishes to all those young ambassadors. You are really inspiring us to do more. And thanks a lot. And we wish you that, I'm sure that many more volunteers would be lining up for speaking in your next event, and it'll be an entire day of inspiration. Congratulations and best wishes.
Thank you so much, Ms. Rajeshri, for that. Your enthusiasm and your effectiveness is so inspiring for all of us. You've definitely been one of the original supporters of Ekam, as you said, since 2009. We thank you so much from the bottom of our hearts for you to be here today and speak to us. It means a lot. So Ananya, could we please introduce the next speaker?
Yeah. Next, we have Dr. Krishnamurthy, who is a psychiatrist in Apple Valley, California. He attended and graduated from Bangalore Medical College, Rajiv Gandhi University of Health Sciences Medical School in 1971, having over 50 years of diverse experience, especially in psychiatry.
I'm sorry, can I interrupt? I'm so sorry to interrupt.
Oh, yeah.
I just want to say Dr. Krishnamurthy is an allergy specialist, and he's actually located in Colorado. I'm so sorry, Dr. Krishnamurthy, for the mix-up. But he's from Mysore Medical College, Graduate Association of North America. And he's been working with Ekam, as he'll tell us about it himself. Hey, he treats people and he makes them better, right? That's what matters in more ways than one. Here you go, Dr. Krishnamurthy, all for you.
Thank you. Samir, can you start the slides?
I have the slides, yes, thank you.
First of all, I was going to say, Ekam presentation so far has given a very good breakfast for the mind. Because, we are in Colorado, it's still in a breakfast time here around 10:30 or so. And the project that I'm going to share with all of you is about the very good cooperation that we got from Ekam India with MMC Ghana that Neelam has mentioned, which is the Mysore Medical College Alumni Association in North America. And also I wanted to appreciate our 1965 batch. That's when I entered the medical school. So I'm going to share some of that. Samir, the slides are ready?
Yes, can you see? Okay, yes, they are.
Yeah, we'll share them right now.
Okay. And while this is being coming up, I wanted to thank Neelam Reddy that she contacted me about a few weeks ago to do a brief presentation. And as I mentioned earlier, this is really a good cooperative effect from the Ekam in a pediatric hospital project in the Mysore Medical College. And I always show this picture. The one that we saw was we all graduated about more than 50 years ago. And then when we had a 50-year anniversary, our graduating class, we went back and we get an idea how we want to help our medical college. As many of you know, most of these medical colleges have really gone down in terms of the facility improvement, equipment, but the patient care has really gone up. This is happening all across India. So because the government is unable to take care of the advancement that's happening in that. So we wanted to help something. So anyway, the class of 1965 batch, MMC, Ghana, and Ekam, we joined together, refurbish and improve the medical facility in Chalwamba Hospital at the Children's Hospital in Mysore in 2019. So the plans were to improve the existing PICU, step-down pediatric ward, pediatric emergency room. So the department identified the areas of improvement necessary for equipment, staff training to accommodate changes in the near future. Next slide, please. Next slide. So you can see this is a common picture that you all see in various parts of India when you go to the big hospitals, especially government hospitals or public hospitals. This is as usual overcrowded. They had, sometimes 3 to 4 children in one bed. It is really, disheartening to see the effect of what is happening in India with the increased population. Can you go to the next slide, please? So this is another picture of the pediatric ward and the existing PICU in the department. Can you go to the next slide, please? So with the information we got with the need assessment, the Children's Hospital requested some of these, fairly high-end equipment. For example, upgrading the 10-bedded hospital, PICU, multi-channel monitors, infusion pumps, syringe pumps, mechanical ventilators, and other equipment. Can you go to the next slide, please? So I've been working on this project for about 4 years. Our 1965 batch classmates in USA, we are around 40 or so. Finally, I was able to contact about 20 people. And we raised approximately $45,000. And with this, what we do is with MMC Ghana, which is our organization, can match that. So we were able to matching funds. We were able to get that. And also we raised some money both in India and in UK. Actually, I see some UK friends here. I have a couple of good friends in UK also. And they also gave the funds. So this is the things that was done. And the Ekam's role was reviewed the equipment list, visited the Children's Hospital, India, did need assessment evaluation, and obtained a competitive bid and chose the vendors and obtained a 5-year service warranty. And I think I just wanted to emphasize this in anybody doing work in India is to really get enough warranty services to these equipments so that it doesn't fall apart after 1 year or so. And the Ekam was helpful in installing all the equipment and staff training, monitoring and utilizations periodically. Next slide, please. So this is actually the final version of the equipment that we did. I won't go into the details. The main thing was actually the respirators, 2 ventilators that we got, the high end, and at a cost of about $64,000. And we had about another 20 lakhs of work done in India when we collected the funds there, improving the pediatric wards. Can you go to the next slide, please? So these are the kind of equipment that was gone. Some syringe pumps here in this picture. Can you go to the next slide, please? And you can see the staff training was done by the vendors' technical people. And they went there and spent a couple of days there and trained. And only one good thing I was going to say is we got everything done just before the COVID, actually. And you can see they're wearing the mask by the time they started installing the equipment. The COVID has just started. So then we got some utility information after that. It was very helpful. And so I just wanted to thank all of you at the Ekam, and also special thanks to MMC Ghana and a big namaste to Ekam and also Ekam USA. And I just wanted to say what I saw was at the Ekam today's program. When you see the youth involvement in US or in other over the globe, the sustainability of Ekam will be for permanent. I'm very confident when you see the youth involvement, we have sustainability of the program itself, which is the Ekam. And I wanted to thank Sai Lakshmi. I spoke to her a few times, and she's a blessed person that all of you know that, but she has done a phenomenal job in maternal and child health care. Thank you very much.
Thank you, Dr. Krishnamurthy. Yeah, definitely. It was so inspiring to see the things that you did in Ghana and how Ekam and how you explained how Ekam was also part of that. So I'd really like to thank you. Our next speaker is Dr. S. Elil Rasi, and Dr. Elil Rasi is a pediatrician in Saligramam, Chennai, and has experience of 28 years in this field. Dr. S. Elil Rasi practiced at the Mayura Clinic in Saligramam, Chennai. She completed her MBBS from Kilpauk Medical College in Chennai in 1985 and has a diploma in child health from Vardhaman Mahavir Medical College and Sarfang Hospital in Delhi in 1989, as well as and she's an MD in pediatrics from the Stanley Medical College and Hospital in Chennai. Let us now welcome Dr. Elil Rasi to deliver her address.
A very good morning, afternoon, and evening, as the case may be. And it's really a proud moment to be part of this elite and august gathering. And it is just to see that the whole world is geared up to help Ekam, to help the children and mothers across the world. It is really heartwarming. And my association with Ekam is that, like, first when I was a junior assistant, once I have to go to a Balwadi to screen the children for illness or any vitamin deficiencies. I was wondering who was actually asked for this system. Then I went, we referred some children back to a hospital. Ours is a 837 bedded exclusive children hospital, the biggest in Southeast Asia. So we referred all these children to our hospital, and we kind of evaluated and treated them. And it is when they just looked up like who has started this project and all that in 2009. And I found it was Sai, who was just somebody, to become my close friend and a great person today, and see that she has grown in all throughout the globe. And, she's really standing as an example. Proud of you, Sai, and grateful all the good hearts for helping. Actually, the concentration of the concept of Ekam was to target the mother and children. It is true, because if you take the population of ours in India, 1.38 billion, almost 70% is only mothers and children. Unless you target them, you cannot have a sustainable growth in the country. And what happens is only a healthy mother can give to a healthy newborn and a healthy child, healthy adolescent. Though maternal child health care has been there in the Indian system as early as 1921 and again reinstalled by the National Health Mission in 2013 as reproductive child health care with newborn child and adolescent, you realize that it's a cycle. A healthy mother, healthy child, healthy adolescent, again the cycle goes on to become another mother who can give rise to a healthy nation. So this is where the Ekam has intervened. And though we have a very good health system in Tamil Nadu in 32 districts, and very proud to say the highest number of SNCUs, that is a sick neonatal intensive care is in Tamil Nadu, but still to refer them here, to identify them, give good food to the poor, all that was taken by Ekam. So the vision of Sai was that she picks them and she works with the government, with the private hospitals, with the government hospitals. So where there is a small lacuna, she tries to fill it. So, like, for example, like suddenly we think we want to buy 2 more ventilators for the PICO, and we plan. In the meantime, she'll try to give us ventilators for rent, so that she'll cover the rent, and we manage that before we get the ventilator. So she was trying to build in. So all the poor, and Tamil Nadu does not cater only to Tamil Nadu. You should know that most of the Andhra Pradesh in Kadapa, Nellore, they don't have a free health system, whereas here it is, everything is free. In Tamil Nadu, government is 100% free. We even give food for most of the mothers who are staying with children. So most of these patients come. So our health requirement, health need is very high. Even today, the in COVID pandemic, the Tamil Nadu government is giving free food to the patients and the doctors and nurses on duty. Literally, it's crores of rupees are flowing for the healthcare. So in spite of all this, you realize that we also need some help. So it is when that a person with a dedication like Ekam comes into view. They give us small things, what we ask, we don't ask. Also, they donate things. We can concentrate on bigger things. See, for example, in this COVID pandemic, we got lots of caps and gloves because every time we have to discard the gloves examining a patient. We don't use so many gloves. So now we have to wear caps, we have masks. So all this voluntarily, if somebody comes and donates you, it helps in the patient care. So this is how she has been helping us. Her idea is that every mother and every child should get the maximum health care. And that is the aim of all of us. So the idea of Ekam when we started, and now I realize the Ekam Foundation and 20 things in US, they are able to get so many youngsters involved, collecting money, feeding people in the COVID. It is just astonishing to see that they're not only helping India, they're also helping their own colleagues who need food, and it is absolutely fantastic. So not only to say that, I think, see, I keep talking about receiving and getting things from Ekam, but I think it's our duty also to promote donation. So what in my, see, I also in charge of the pulmonology. So when I discharge a patient on home oxygen, say, or a child with interstitial lung disease, then the child will require a home oxygen. So see, this machine will require a monthly rent. See, we will give all treatment free and send them home, but that machinery may require rent for a month. So when Ekam will come in to help us by giving oxygen concentrator for home or bearing the rent. So we kind of collect donations from all of us to try to give it to Ekam, because indirectly it is helping us, helping the children, helping everyone. And not only that, she also follow up, and also follow when we discharge the sick into some village, newborn who is sick and improved and gone, they have an access even to the remote village, and Ekam is available in one phone call. So they kind of help even these children. So this is the kind of service that I have been mainly a recipient, I would say, like sitting in this such a big hospital, and I have been mainly a recipient of all good things, but it is my duty also to give back. So I also keep promoting everybody, telling, keep supporting Ekam. They not only serve us, but they serve everybody across, not only Tamil Nadu, all the 32 districts, but throughout India. Now I see that they are globally to Canada, UK, and USA, everywhere. And so I just congratulate Sai for what she thought was just a mother and child health care, and now she's really gone. She's supplying nurses, trained nurses to our NICU, giving even training for doctors, and it is her idea is expanding. She's growing like a banyan tree. Let her growth continue, and all of you, I'm just amazed at all your volunteers. I thank one and all of you, and let the good service continue. Let all of us grow together and build a strong community with a good health, not only for the mother and child, but for the whole nation. Thank you so much for this wonderful opportunity.
Thank you, Doctor. Your encouragement is so inspiring for all of us to really just push through all the things that we have, and really encourages us to volunteer more and be more involved in ACOM. And thank you for all those examples. So now, Shreya, could you introduce our next speaker?
Dr. Satya Jagannathan is a pediatrician in Chengalpattu Government Medical College in India. She led the creation of a low-cost baby warmer made out of readily available 100-watt light bulbs and locally harvested wood as a solution for cutting the mortality rate of neonates at her rural hospital. Costing only $100 to build a fraction of the cost of commercial alternatives and easy to maintain, the warmer soon reduced the hospital's infant mortality by nearly half. Technical and business development help from LRAMP India is allowing Dr. Jagannathan to further develop the product design and create a business model. This key supports she'll soon be able to distribute the infant warmer to other rural hospitals in the region. Now let's welcome Dr. Jagannathan as she joins us.
Good morning. Am I audible?
Yeah, please go ahead.
I thank Ekam USA for inviting me to the webinar. And it's a pleasure for me to be associated with Ekam. And I'm a friend of Sai. And for the past 15 years, I'm associated with Sai, and we have been getting help from them. And Ekam is one of the NGO through a private-public partnership. It has been helping the rural children for a long time.
So we can't hear you. Can you unmute?
Dr. Satya, can you unmute yourself?
Yeah, we can't really hear you. Are you able to hear us? Sorry, just some Wi-Fi difficulties here.
So there's some net issues.
Yes.
We're good now if you want to continue.
And through the private-public partnership, many nurses were recruited into the system and they were trained into the newborn care. And across the district, about 74 districts, 74 SNCUs were started throughout all the districts in Tamil Nadu. And not only that, these nurses were mentored by the Ekam for nearly 5 to 6 years. Then after that, gradually they entered into the government system to a regular medical recruitment board. And all of you know that equipments are very important for newborn care. And it was, we found it was at least sometime easier to get equipments, but it was very difficult to maintain them, especially in the remote rural areas, because many a time they become repaired and they're lying waste for a long time. And Ekam, they devised an idea of recruiting engineers for all the districts, and they were doing preventive maintenance, and also they were teaching our nurses how to maintain these equipments. By the efforts of Ekam over a decade, the neonatal mortality in the state declined from nearly 21 per thousand live births to 16 per thousand live births. And the same model was gradually being replicated into other places. And not only that, Ekam supporting equipment and nurses, and whenever there is a need, we ask them and immediately it's given. Government of Tamil Nadu, it collaborates with various NGOs, and from the receiver point of view, what is fine, like whenever we give a request to an NGO, it's a very long process because it has to be approved by many directors of boards. But when we tell Ekam and they understand the emergency, and then they try to help us very early. For example, now during the COVID times, we developed a new COVID ward, 250 bedded ward in the mother and child block. It's a newly built building, but we needed emergency oxygen connection from the main manifold room to the building. And we were trying to get funds, and then we told Ekam that we need it immediately. Otherwise, all this rush of patients cannot be accepted. And without any thought, Sai said, okay, madam, we can go ahead with the project and somehow we can manage the funds. And because Ekam asked for the work, and many oxygen pipeline dealers, they came without even getting any advance, and they started working on the project. And it was completed within 2 days' time, and we could move 250 patients into the COVID ward within a short time. So whenever there is a need, we ask Ekam and then they help. And I'm so happy to see that so many people are helping Ekam throughout the world. And I'm very thankful to you. And from the children and the mothers of Tamil Nadu, we thank you from the bottom of our heart. And I hope all of us can work together with Ekam to help the mother and children. Thank you.
Thank you so much, Doctor. Yes, and your inventions are truly inspiring for all of us to really work harder and more. Now, as we near the end of our webinar, I'd just like to say this is where we collect all our thoughts from this webinar and we put it into a call for action. What the call for action is basically a list of not only demands, but also plans for the whatever we discussed in this webinar today, whether it be the statistics that we've shown and anything that we discussed, we will put it in a call for action and we will see what we can do, whether this be submitted from Ekam to different governments to implement the ideas that we've already put in. So this would be one of the best ways to implement everything that we've done. And we truly like to thank everybody from the bottom of our hearts to coming today for this webinar. We have some information on volunteering if Dr. Neelima would like to share her screen and explain.
Okay. Yeah, thank you, Samir, and thank you everybody for hanging on. This has been amazing. And, it's all oneness, losing ourselves. So no need to thank everybody one in person. Please go to the website, ekamusa.org, ekamuk.org, or ekamoneness.org, because we need your support for donation as well as volunteering. You'll find the volunteer forms on the left side, the youth volunteer form and the adult volunteer form. These are universal. So if someone wants to sign up to become an adult volunteer, if you go to tinyurl.com/ekamvolunteer, we can direct you to UK or US or India, wherever you're located, it will direct you there. So please put in your talents, and same thing for the youth ambassador, although at this time it's mostly for USA. You can choose to donate directly with any of the ways that are given with the tiny URL or just on the website of the respective organization. A continued monthly support is well appreciated. And we just need you to be continuing the work and join us in this great effort that was started by Sai. And we thank you just for joining us. Samir?
Yes, thank you. I just wanted to say another thank you to all of the speakers and Dr. Neelima for that volunteering. Dr. Sai, if you'd like to say any final words, parting words for us.
Yes, Samir, it's amazing to watch last 2 hours. It's really amazing. And I would really like to thank the youth ambassadors who have given me a hope. And I think now I can plan the exit strategy for myself, because the hope and so much of, you guys are amazing. And truly entrepreneurs and wanting to do, good to the community. It's really amazing. That was the intention. The values, once, taste of the values, it sustains on its own, and sustainability is seen now here. So what else to say? I'm soon planning my exit strategy. So, and thanks to Neelima, amazing effort grooming all the youth here. And I still remember during our medical school times and during our house urgencies, the time when Neelima was coming to US and I was planning to be stay back. And that was the time I told her that, whatever happens after 10, 15 years, you have to support. And amazing, it is happening. And rest of the team joining, Ajay, Preetham, and Rama, and it's really amazing. All the medical school friends joining, and it's really so beautiful to see this growing. And thanks to Harigaru, it's like, as he said, Ekam got started with this great support, and Lead India's support is truly appreciated. And Rajeshri, and it's really amazing. Cognizant is like a family for us, and it's amazing like how we all travel together. And Dr. Elil, Dr. Satya, it's really amazing. And I feel so blessed, and I really like to thank God for giving me this great opportunity to be an instrument. And also my parents and my guru, Dr. Avadut Shivanand. And thank you all very much, and thank you so much. And may God bless all the youth ambassadors. You are amazing. Thank you.
Thank you. And with that, I'd just like to formally say that we have successfully concluded the webinar. Thank you everybody for taking time out of the precious time out of your day to come here and talk and be a part of this team. Thank you so much.
Wonderful. Thank you very much. Hello.
Thank you so much.
Thank you, Ram Garu. I think if we go off YouTube Live, we can just have the team on.
Yeah, no problem. My pleasure, and it's very much, very, very nicely organized, and I really thank organizers, and especially our chairman and founder, Dr. Hari Ippanapalli Garu, for blessing this great event today, and Ekam Global Organizations. Thank you all.
It's an amazing idea that Dr. Hari came up with, and this cannot end without thanking Samir for coordinating all this while he's doing his schoolwork. Thank you so much, Samir, and each and every team member, Mani and Rama, and everybody that has spent hours and days into this thing, Charles, Shubhashri, each and every team member in India, and all the youth and coordinators in USA, everybody that made it happen. Thank you.
Wonderful job. Congratulations to everyone. I think Samir, you pulled it through very well. I think now every youth on this session probably plan monthly sessions in your local regions and excite people to get involved in Ekam's initiatives and support this. And it will help here locally as well as in a global level, and especially what Sai has been doing in India. I think it will go a long way. Thank you so much for everybody for joining us today. Wonderful job. Congratulations.
And I want to say thank you for all the help that I've given for Ekam. We are actually planning to do one more project in Mysore Medical College to the obstetrics and gynecology Chelwamba Hospital. We are going to be probably doing about 90 lakhs worth of project where we can get the modern equipment to the Chelwamba Hospital, and I will be reaching out to Sai, Lakshmi and their team in India, and they really helped us in transferring the funds and very cooperative in the system. And what I'm trying to say, another point is, we have a lot of medical colleges, doctors like us who are in this country. We don't know how to help back in your own medical college or your own district. Doesn't matter which part of India. I think Ekam could be another conduit to help this out, because they figured out how to take care of these transfers of funds and implementation of the project. And I know API is getting involved eventually, which is a bigger organization. And in the closing, I was going to say just a simple word, which I thought, Sai has become a godmother, I call it, which is she has become a mother of children for all over the world, not just to her own family or something. And I appreciate all her work. Thank you very much.
Thank you, Dr. Krishnamurthy. That presentation was really good for us, the same reason that other medical colleges and alumni can see what you have done at your institution and be able to do the same. Thanks to Kusuma for connecting us with you. And I want to point out that Ekam Foundation in India has maintained the utmost, efficiency in maintaining the regulations, and especially given the new regulations placed on nonprofits in India, and they have all their papers in order. And that is why we are able to send money to them, and because they are always in good standing, and that will help anyone else that would want to do that, as long as they work with them on the ground.
You're right. I think that the Ekam has the CRA updated all the time. They are actually active right now. I know we have been talking to Sai Kiran, the director there, and they are you're right, they have the FCRA approval. We do have some other NGOs in Karnataka, but they're not FCRA approved. We can't transfer any dollar funds. So you're right. Thank you.
Ram Gary, are we still on YouTube, or we can just have the team perhaps if we're not on YouTube?
Yeah, you want me to stop live? I will do that, right?
Yes, we can be done with that.